Dr. Roy Givens is an emergency physician and co-founder of LifeTrack LLC. Dr. Givens speaks 4 languages and holds a master's in mathematics. 90% of the time that Dr. Givens sees a patient in the emergency room, it is the first time he has seen that patient, and oftentimes knows very little about them. In the following video, Dr. Givens shares with us the importance of information in a critical situation and how LifeTrack addresses that very serious need.
There have been a lot of changes in medicine in the United States in the last 25 years. And those changes involve the fact that oftentimes if you come to the hospital in the middle of the night or even during the day, you're not very likely to be taken care of by your physician when you get there. First of all, EMS arrives at your house, and when EMS gets to your house, there's some really phenomenally powerful medications that EMS is able to administer to you right there in your own home, even before you leave your living room or basement or wherever you've fallen and can't get up. Sorry, I couldn't resist that. The issue basically is that the problem with giving these sorts of medications and the problem with providing these sorts of services is that we need to know a lot about you. We can't do these things without knowing what medications you're on. We can't do these potentially life-saving therapies unless we know what you're allergic to and unless we know what sort of medical problems you may or may not have at the time. So it's really great if the more we can know about you and the shorter period of time in which we can gather that information, the better. So I was thinking about how to kind of make that point, how to get that across, and so I came up with a few meetings ago, I came up with this little spiel where I talk to you guys and I say, look, I'm going to act like a medical student and I'm going to sort of present a patient to you the way a medical student presents a patient to a doctor when we're in training. So I'll give you an example here if I can pull myself together and remember when my head was that small and when I was that young. All right, Mrs. Smith, sir, is a 63-year-old white female with a history of coronary artery disease, diabetes. She has a touch of emphysema, possibly some asthma as a child. She has rheumatoid arthritis, and she presented to the emergency room earlier this morning, short of breath, with oxygen saturations of 87%. Okay? For her rheumatoid arthritis, she has recently been on a pulse of high-dose steroids. She takes methotrexate regularly for this. She uses inhalers for her COPD. She is on metoprolol and hydrochlorothiazide for her blood pressure, and additionally is noted to be allergic to penicillin. Okay? Now, what have I just learned? The medical student and I are walking down to the ER. Oh, by the way, she smokes. Okay, now we're walking down to the ER. Now, in 30 seconds, I just learned an enormous amount of information about this lady. I know that she's a smoker. I know that she has a touch of emphysema. I know she has heart disease. I know she's diabetic. Because she's diabetic, I know her heart disease could be severe. I know her blood vessels have been damaged by the diabetes over a period of time if she's not taking good control of her sugars. I know that as a result of these damaged blood vessels, she's at some risk of having a blood clot. So on the way down to the ER, I know a bunch of things about her. I know that she's short of breath, and I know she's short of breath possibly because she's just having an emphysema attack. Could be. I also know on the way down to the ER that she's possibly got pneumonia. In the back of my mind, I'm worried. I'm worried because this lady has rheumatoid arthritis and she's on big dose steroids. Because she's on these steroids, she may not be able to have a fever. She may not even have an infiltrate when we do a chest x-ray. There may not even be a picture of a pneumonia on that chest x-ray because she can't mount the immune response necessary to really fight off that pneumonia. So that if I do a chest x-ray, there could be a pneumonia there and I won't see it. I know that these things are going on. She could have a blood clot in her lungs. I know that she could be having a heart attack. I know she could have already had a heart attack. Now, I know all of that because this medical student told me in 30 seconds what the medical student told me. Do I know what she has before I walk in the room? Well, no. but I know what tests I want to order. I know automatically that she's got to have a chest x-ray, she's got to have an EKG. I'm going to do a special blood test we do to see if she's got a blood clot anywhere in her body preliminarily. I'm also going to keep in the back of my mind that I'm going to go ahead and do blood cultures even if she doesn't have a fever, because she may be immunosuppressed because of her rheumatoid arthritis and because she's on those steroids, and may actually be almost dying from an infection and not mount a fever and possibly even have a normal or low white count. Do you all understand why I need information? Do you understand why I need to know what a patient has wrong with them? Do you see how incredibly helpful it is if this lady had this list in her pocket? Now, in this scenario, I do. Of course, the only person it would really help a whole lot would be the medical student. As the big doctor up on the floor, I can send the medical student down and let the medical student spend 3 hours trying to find out all this information. And then when he or she has gathered all this, they can, the person can come back and tell me this, and then I get to make up my mind in 30 seconds what's going on. But you know what? We don't always have 3 hours. I'm an ER doctor. I don't have medical students. They don't work for me. In the middle of the night, I'm the only guy walking in the room. And in the middle of the night, when I come into your room, wouldn't it be fantastic to have your information at your fingertips? Those of us who practice medicine, particularly medicine in an emergency setting, particularly when every patient we see for us, almost every patient we see is a new patient we've never seen before. We've been dying for people to have a record like this in their pockets. We've been praying for this. And it will save a tremendous amount of time. It will save some lives. I'm not here to say that it's going to save 10 lives a night. Okay, come on. But it's going to, nationwide it'll save more than that. I can guarantee you. But it's going to save lives. It's going to cut down the amount of time that we spend communicating important information, particularly in situations where we may not have that time. I need to see an old EKG on you when you come to the hospital and have chest pain. If I've got an EKG that's abnormal, I don't know if that EKG on you that's abnormal is abnormal because it became abnormal this morning at 8 o'clock or has been abnormal for 15 years. If I have an old one for comparison, I know a lot of things. If you had a normal EKG last week and you've got an abnormal one today, I need to sit up and take notice. These are just tremendous examples of things that we can put on your card without any difficulty at all. So, what I would like to do, and my whole goal and my whole reason for being here and for wearing my ice cream suit and talking to you guys, my whole reason for being here and talking with you is that I want you to have exactly what I need to know to take care of you in your pocket and available at a moment's notice if I have to take care of you at 2 or 3 o'clock in the morning on that dark and stormy night that, comes along every now and then. So please help us get this message out. Your job, if you're willing, your mission, if you're willing to accept it, is help us spread the word. Help us get out here and do this. Let's get our information wrapped up once and for all, and let's put it in our pockets. Thanks.